everyone. Thank you for tuning into this special Facebook Live event, a Cancer Council Australia Q&A talk, all things COVID-19 for people living with cancer, their families and their friends. I'm Kate Orbison, I'm the health editor at the Sydney Morning Herald, and we have here the CEO of Cancer Council Australia, Professor Sancha Aranda, to answer all your questions. Hi, Sancha.
Hi, Kate. Hi, everyone.
So you can probably tell that Sancha and I are not together. I'm not in a newsroom either. I'm in my home where I've been working from home the last few, months now. And Sancha, you've been doing much the same, haven't you?
Yes, we've been at home for about 10 weeks now, which is pretty incredible.
Yeah, I'm sure a lot of you guys are at home too, working from home, staying home, keeping safe in these very uncertain times. But we're also sort of coming out of hibernation now, which can bring its own questions and anxieties. It's certainly an understatement that this coronavirus pandemic has been challenging, and no more so for people with cancer. It's created a lot of new challenges, unique challenges and complex challenges for cancer patients. And the Cancer Council wanted to host this live event to give everyone the opportunity to ask Sancha some questions. And Sancha, you'll be answering them all, well, almost all of them. I guess the one housekeeping thing we have to mention first is that we can't give anyone medical advice, and you wouldn't want us to either. So if you have any specific questions about your own personal circumstances, your treatment or your symptoms, we please ask that you contact your doctor. So let's get into it. Everyone, if you have any questions for us, you'll see a comment section. Please just punch in your question there, and then and we can throw it to Sancha. I actually have a question for you first, Sancha. I'm wondering, especially now that restrictions are easing, what do you see as the greatest challenges for cancer patients over the last few weeks and leading into this next period of the pandemic?
Probably the biggest challenge for people who are currently undergoing treatment is that as the world opens up, they are really facing decisions about how much they're going to go out, how much they're going to interact with other people in their family and their friendship networks. And yeah, they're probably still feeling quite scared about that. And for many, they'll be making decisions about the changes that will take place in their interaction with their health professionals, because many of them have been moved to telehealth and remote consultations, and some of those things may or may not continue.
And is there a certain aspect that you're most worried about for people living with cancer?
So for people who are living with cancer, we're particularly concerned that they may delay presenting with complications or symptoms associated with their cancer because they're worried about going to hospital. And for people who might not have cancer yet but are not participating in screening because they're worried about going to their GP or they're not presenting with symptoms, we know from overseas experience that there's been a lot of delays in cancer diagnosis, and we're starting to see reports that that's some of what's happening here. Peter Mac, for example, the big cancer centre in Melbourne, seeing 25% less new people coming through their doors. And that means that people might get a later diagnosis and therefore a poorer prognosis. So we're really trying to encourage people to really continue to interact with their health professionals and get advice about what they should do with any symptoms they might experience.
So if you haven't seen your a medical team for a little while, it's probably time to give your doctor a call, give the clinic a call and see if you should come in for a checkup?
Yes, certainly if you don't currently have cancer and you've had an invitation perhaps for cervical screening or for breast screening, really getting that appointment made now is important to be up to date with those things. Interestingly, we haven't seen a reduction in the number of people doing bowel screening, so perhaps being at home more means that kit that comes through the mail is easier to send off. But if you are a person who's already got a cancer diagnosis, now's the time to be talking to your doctor about the next stage in your cancer treatment. We know that people have been concerned that cancer hasn't been being treated through this pandemic, but in fact, cancer is considered a Category 1 procedure, and so services have kept running through this time, and if you've got something that needs to be done now, it's the time to get back in touch with your cancer team and get that chemotherapy started or your radiotherapy booking made if that's what you're waiting for.
And know that these places can be kept safe by the medical teams there as well.
That's right. We've seen a big shift to telehealth or remote consultation, particularly for people who are in follow-up. And we've done a lot of preparation in the sort of messaging that people need for those consultations, for example, how to get prepared for that, to ask if somebody else can join those consultations, even if they're at a different site, making sure that you're writing down the questions that you might have for your doctor or health professional so that you're well prepared for those conversations. So you feel a bit strange and different when you're not in the same.
Yeah. I'm sure we'll have some people asking about telehealth because it is such a big change. We've got Rebecca who's saying hello, and we've got a question from Emma. Emma asks, I have a friend who has cancer and I want to know if I can visit her at home and if I still need to keep the 1.5 metre distance.
So it's important that people who are going to visit somebody affected by cancer, that they do a bit of a self-assessment. What have they been doing, making sure they've not got any symptoms or flu-like symptoms that might indicate that they're at risk of having COVID-19, but you would do that anyway. You shouldn't be visiting people with cancer if you've got a cough or a cold, so those are great self-assessments to do. And if you are going to visit, try and do that out of doors if you can, so that it's easier to keep social distancing and you're not kind of touching all the surfaces in somebody else's home. And if you do visit, make sure that you do keep that social distancing. Try and avoid sharing food and drink. Those are some of the things that increase the risk of transmission of this virus and any other virus as well. But certainly ask the person how comfortable they feel and try and do that in a safe way.
We're getting a few questions from people who have friends with cancer or family members with cancer. Lisa asks, my friend's mum has cancer and is really concerned about COVID-19 and her treatment. Do Cancer Council offer any written guides in Italian that my friend can share with her mum?
So you can go on to cancer.org.au and in our opening banner there are COVID-19 resources, and the main advice resource has been translated into a number of languages including Italian, and so that is available to you there as well.
I imagine one thing that, well, certainly people have been asking me and asking in our own comments is, my friend has cancer, my family member has cancer, can I hug them? Can they hug me? And cancer patients asking, can I be hugged because I really miss that human interaction? What's your advice for them?
So our advice would be not to engage in physical contact unless you are part of that person's household environment. And when you are living with somebody who's got cancer, then making sure that you are very careful about how you're interacting with the outside world. So we know that the highest risk behaviours, if you like, are things like being in crowds. And so making sure that if you are living with somebody who's got cancer, that you try and avoid crowds, maybe avoid public transport, being much more careful about your own hygiene. So hand hygiene is still the most important. That 20-second hand wash with warm soapy water is still the most effective thing you can do to reduce transmission of this virus, as well as cleaning down the surfaces that you touch regularly in the house together. But hugging, probably not so much.
Yes, you probably saw someone in the background just go in my house, just go to wash their hands coming home from the scary outdoors. So thanks very much for your comment. Emma's just thanked you, Sancha, for your advice. Christine asks, I live 4 hours from Melbourne and I'm due to visit my haematologist. Is it safe to make the trip?
So it's certainly safe to make that trip, and if the haematologist is wanting to see you face to face, they will have a reason for that. But you can ring and ask if the trip is necessary. If it's a follow-up appointment and you can have any of the sort of blood tests and other things that you have locally, then it's probably safe to have those consultations remotely, and you can ask those questions of your doctor.
Mm. For those who just joined us, I'm Kate Orbison. I'm the health editor at the Sydney Morning Herald, and I'm here with the Cancer Council CEO, Sancha Aranda. She's answering all your questions about COVID-19 and cancer. We've got a question from Natalie and Kate. Kate, I'll come to yours in a second. Natalie asks, I was diagnosed with leukemia CLL3 3 years ago, and I am still at watch stage. I am a kindergarten teacher. Should I be teaching in a school in the current climate?
So this is one of the areas where there's a lot of mixed advice, and for someone with CLL, it would be important to clarify with your doctor the level of immunosuppression that you have. I'm assuming you're not currently on treatment because you're talking about being in the watch stage. So you're probably not at higher risk of catching the virus, but you do need to be much more careful in the workplace than average. And it's very difficult in a kindergarten environment because kids, you do need to touch them and you do need to do that interaction. So this is one where you would, I think, need quite specialist advice from your doctor about where you are in your overall immunosuppression situation.
John's asked a question too, which actually is a very good question, as is Kate. John, I'll come to yours in a second. Kate asks, I was talking to a person this week who has been told that they were to come to their oncology appointment by themselves rather than bringing their carer. What is your advice on that one? And what advice would you give this couple navigating that situation?
So this is being asked of people to try and limit the number of people coming through hospitals. And so what I would be asking is it possible for the family member to join the consultation remotely? Because it really is often important to have somebody else with you in the consultation to be able to ask questions and write down the things that you don't remember. And so it could be possible to bring that relative in remotely. And really, if you feel that you absolutely need someone with you, then challenge those things a little bit too and see if there's an alternative way in which you can manage that interaction.
Yeah, I can imagine it would be very helpful to have someone there with you, and you do have to sort of balance these risks and support. Duncan's asked a question. I'll come to Duncan in a second. John asks, today I'm 12 months post-completion of chemotherapy for metastatic testicular cancer. Now that my counts have recovered, is my risk of COVID still higher than the general public?
So your risk of catching COVID-19 is not higher than the general public, almost certainly, but it will depend on whether or not you're still immunosuppressed as to whether or not you are more at risk of the complications of COVID-19 were you to contract it. And so my advice would still be to be very careful and vigilant about staying away from people who are with any kind of symptoms of flu-like symptoms, and still staying away from crowds, because there is a significant chance that you've got above average risk from getting the virus.
Duncan has well, he's got a very good wife by the sounds of it. He says, my wife keeps me at home in a cocoon while she occasionally goes to Kmart and the supermarkets wearing a mask. Does this negate me staying at home?
So it doesn't really, in the sense that at least you're not being exposed to those other individuals. And as long as your wife is being extra careful when she's out and when she comes home, making sure she's washing her hands and regularly cleaning through the surfaces in your home that might be touched when she does come home, door handles, light switches, bench top counters, tables, shared eating surfaces are all the things you need to pay particular attention to. But also there's a downside to being kept at home in a cocoon, and so I'd actively encourage you to at least get outside, go for walks with her around the block, and do the sorts of things that you can do without being exposed to a crowd, because it can, as we all know, we're all going a little bit stir crazy being at home all the time.
Oh yeah, I definitely need to get out at least once or twice a day, or I'm a very, very strange person.
And it's also, Kate, I was just going to add in there that because there is a relatively low level of the virus in our community, we do need to be able to balance those risks, as you said. But one of the things we do advise is that your family and friends download the COVID Safe app, because that can help to get early notification that there's been any exposure, and then you can seek medical advice and early testing and early intervention were you to contract the virus. So that's one of the great things that you can do for your family members and friends who have cancer, is to download the app.
We've got 2 more questions, one from Jess and one from Kate. Jess says, currently halfway through chemo treatment and have a 2-year-old who we have taken out of daycare. Interested to know thoughts on daycare and when would be a safe time for my daughter to return. She says her last chemo is mid-July.
Yep, so if her last chemotherapy is mid-July, I'd be waiting at least 6 weeks after that, and then you'd be due for some regular blood tests, and then talking to your doctor after those blood tests to see that your white cell count has come back up. But I think it's been a wise thing to take your child out of daycare at this point, but remembering that also you're going to need some child-free moments, so seeing if there's some other safe way to at least get some care for your 2-year-old at the same time, perhaps with a close family member who you're interacting with anyway.
Okay, so who have we got? We've got Kate and Helen. So Kate says, I was talking with a person this week where they had been, I've been talking to a person this week where they had been told they were to attend their, Kate's question's popped in twice. I hope we already answered your question about that one, Kate. If not, definitely put in another comment and we'll answer it in text. Helen says, a friend of mine is due to have her first telehealth appointment and is a bit nervous. It's going to be a strange experience and she won't get as much out of it as face-to-face. Do you have any advice for her?
Absolutely, we do. So the first thing is to do before the meeting, make sure you know what technology is going to be used and get that all set up beforehand. Have a practice run with a family member if you've not used the sort of technology before. Make sure that you're dial in a few minutes early just to make sure that it's all set up. Have a list of questions ready, and so that you know what it is you're going to want to get out of that consultation before the end of it, and ask if a family member or friend can dial in if they can't be there with you in the room where you are. Also be connected into that consultation so that they can assist you with what you want to be able to get out of it, and really just try and be clear about what it is that you want to be able to control in that conversation. And if you're worried about it and want some practice in thinking about the questions that you might ask, please ring one of our health professionals on 13 11 20, and they'll help talk you through how you get the most out of those consultations.
And what's your advice? What's your feedback from people who might have talked to you or other Cancer Council colleagues about these telehealth appointments? Are they working well? Are people finding that they are helpful?
A lot is depending on how comfortable the clinician is, because this isn't just a massive change for patients, it's also a massive change for many of the oncologists right across the system who are not used to using telehealth. And so we've also been trying to put out some advice for the health professionals as well, because they're finding it very strange. We're finding that people are doing much better when it's a video conference, because that interaction, you can at least see expressions and have that more human interaction when you're on video than when you're by phone. But it's most difficult when it's a new diagnosis consultation, because patients are experiencing much more concern and anxiety. They don't know the person that they're interacting with, whereas if there's an existing relationship, then that makes the telehealth consultation much easier. So the more you can get prepared, the better it will be for you.
Yeah, John says he agrees with you, Sancha. He says, I had a telehealth review last month. It's definitely not the same, so be prepared. So for those who just joined us, I'm Kate Orbison. I'm the health editor with the Sydney Morning Herald, and I've got the CEO of Cancer Council Australia here, Professor Sancha Aranda, answering all your questions about COVID-19 and cancer. I've got a follow-up question from Jess. She said, I forgot to include that we are not letting our 2-year-old see any other children or anyone out of our bubble, especially my niece who is at daycare. Would this be your recommendation, mainly as it is hard to ensure she is following hand hygiene, etc.?
Yes, so certainly other children, that would be a concerning interaction, but I think it's important that you think about your bubble as it starts to open up and make deliberate decisions about who you're opening up to. And there'll be friends or family members who perhaps aren't interacting, don't have young children, maybe it's younger grandparents or aunts or uncles who might be able to start to do that interaction, because it is this interesting balance between keeping your bubble relatively tight, but also keeping your psychological well-being and support mechanisms up. And by being really careful about how you do that and who you're interacting with, it can be a safe way to start to open it up.
We get a lot of questions about people who don't have cancer themselves, but have loved ones with cancer and don't know what they can do to help them in this time. So what sort of things can they do?
So they can certainly make sure they're keeping interacting. So telephone or these kinds of video-based calls can be a really useful way of doing it. I've been in my neighbourhood visiting a lady and standing at her sort of front fence and talking to her through the door. So that it's that still keeping the social connections up and making sure that you're offering to do things like grocery shopping and other household tasks like that, which are actually the highest risk activities. And if you can do those for the person affected by cancer, that's important. We've also developed a relationship with both Coles and Woolworths supermarkets, where if you are a person affected by cancer, you can ring our 13 11 20 helpline and get a special code that you can use to get priority home deliveries. So making sure that people are aware of those support services out there is also an important thing you can do.
And just ask them, I guess, as well, like, what do you need? What can I do?
That's right. And if you're a person with cancer, write a list of those things. What are the things that would be really helpful to you in your situation? Because when people ask you, it's often really difficult to say, oh, I want X or I want Y. But if you've got a list, then you can start to match people up to those tasks. And if people ask, it's because they genuinely do want to help.
Yeah, sometimes it's just hard to ask, which is strange because so many people do want to help, especially in these very challenging times. We've got a really lovely comment from Renee. Renee says, you guys have been doing a wonderful job. You put me at ease post-treatment regarding COVID-19. And we've got a question from Megan. If we do have to go to hospital for an appointment, should we wear masks or do anything else extra to keep safe?
So the mask question is one of those really controversial ones, and I was just reviewing the government advice about that this morning, and it's completely silent on people who've got higher risk from contracting the virus, like people undergoing cancer treatment. So our recommendation would be, the most important thing is hand hygiene. Carry an alcohol-based hand wash with you wherever you go, so that if you can't get to a hand basin, you are washing your hands. But do invest in some masks, so that if you're going into a crowded space, such as an outpatient clinic, if there's more patients there, but also if you do have to use public transport, masks would be appropriate for those situations, because you can't get away from anyone who might be coughing and sneezing and not taking care about you. So it is worth having some and using them in those situations, but you certainly don't need them if you're going for a walk in the park and being spatially distant from the people around you.
And what kind of masks should they be wearing? Is it just sort of surgical mask or a mask they buy from the chemist? Is that the kind of thing you're talking about?
Just surgical masks. Even some of the new cloth masks that are coming in are okay. Make sure that you're only touching them from the earpieces and not touching the front of them, because that's contaminating your hands, and removing them that way as well. But you certainly don't need the high protective equipment masks that you see being worn in some of the things on television, because that's about for people who are exposed to very high levels of the virus.
Yeah. So Emma's just sent us a question. I'm halfway through chemo and my son just returned to a high school of 2,000 students. My husband might have to return to work soon in healthcare. Should he take more time off work if possible, or return to work? Also, how do we reduce the risk of my son bringing illness into our home?
Well, that's a really complex question. So there are some things that you can do within your home when you're living with people who have got higher risk. If it's possible to have a separate bathroom for you, that's one of the ways that you can do that, so that you're reducing the number of surfaces that you're sharing. Being really careful about things like meal preparation and keeping that separate, doing additional cleaning around those shared surfaces, and certainly avoiding physical contact with those who are going outside of the house.
And of course, the son and the husband would be very, very rigorous with their hand hygiene and all the sorts of things they need to do when they're outside as well.
That's right. And just making sure that you sit down as a family and talk about the things that you might do together. The trickiest one's going to be for the son, of course, because the kids are all going back to school. They're going to be testing the boundaries on all these relationships, but making sure that he really is doing the things that he needs to do to keep safe will help you keep safe.
And something else that pops up a lot amongst Sydney Morning Herald readers is from grandparents. They ask, well, they really miss being able to hug their grandchildren. So people with cancer who are grandparents, should they be hugging their grandchildren, or is it something that they have to put off for a little while longer?
So if they're grandparents who have cancer and are at high risk, then they probably are better off avoiding hugging grandchildren. But it's again one of those things where we're starting to move into this period of this pandemic where the risk is actually quite low. And if there's been no outbreaks around you and you're keeping yourself safe, and those children are perhaps living, I know my grandchildren are living in quite a pretty protected bubble at the moment, then you'll be making those risk judgments yourself. But I think we're certainly starting to see a bit of a lifting of those extra special precautions that we were taking in the beginning.
I'm still social distancing with my friends and most of my family, and doing the old foot tap or the elbow bump. When it comes to friends and family, a hug's still something that you shouldn't be doing. So grandchildren aside, what about sisters and friends? I mean, should we sort of be putting off our hugs in general?
We're all putting off our hugs. I think this is going to change us as a society for a pretty long time, actually, if not forever. I'm certainly not hugging any of my friends and doing the elbow and foot touches. And we're also entering flu season. So flu's also, and colds are also risks for people with cancer. And so that's one of the reasons why those kinds of behaviours should be normalised for people who are affected by cancer right through their cancer journey. And COVID-19's just made us much more aware of that. We've always, as health professionals, given that sort of advice to people affected by cancer, and it just becomes more critically important when we're dealing with a virus that's as bad as COVID-19.
Yeah, no, you're probably right. We'll probably come out of this very, very different in many regards. Madison sent us a question. She says, I'm a carer for my mum going through cancer treatment at the moment. Would you recommend avoiding public transport? She says she's been very hesitant.
In terms of Madeline herself avoiding public transport, it's certainly going to...
Yeah, I think that's what she means.
Yeah, it's certainly going to be one of the biggest risk areas as we open up our society. And so if you can avoid public transport, it's certainly best to do so. And if you are going on public transport, make sure that you are taking a hand sanitizer with you. I would advise in that situation, if you're really wanting to protect your mum, to wear a mask and to just be extra careful when you get to your mum, wherever you are, that the first thing you do is actually go to the bathroom and wash your hands and avoid those physical contact with her as much as possible.
Yeah, we might be wrapping this up fairly soon. So if anyone has any questions for Sandra, please send them in now and we'll try to get to them. So Lewis asks, I'm watching a friend with cancer who is struggling with their mental health through isolation and COVID. What can I practically do to support them?
So staying in contact is really important because the physical things are much easier to develop rules around, whereas the mental health challenges that people are experiencing are there for cancer patients anyway, and then they're exacerbated when they're becoming socially isolated. Perhaps recommend that they talk to one of our 13 and 11, 20 staff who can talk to them about the sort of available support groups that are still out there. Our online community is still running right through this pandemic, and you can join groups of patients in that way. And we also have telehealth items now for psychological support and social work support, so that we can begin to access those services. But the most important thing for Lewis is to stay connected and really talk with the person about what would help them. Is it going for a walk around the block for a bit? Is it going for a drive in the car and just getting out and seeing something different? Really ask them what would help.
Yeah, it's something that's probably not unique to cancer patients. I think a lot of people are struggling with their mental health through this
Absolutely.
period of isolation. Yeah. I've got a question for you, Sandra. I've been getting a few concerned commenters asking about access to their medication. What's that been like during this period?
So from a cancer perspective, we've been pretty lucky, really, in that there's no shortages that have resulted from COVID-19. Probably the biggest challenges have been the extra work it takes to get your medication when you normally you'd go to hospital, you'd get a script, you'd take it down to the hospital pharmacy, you'd get it filled, and you'd be home and on your way with everything done. And now you've got to get the script sent to you from a telehealth consultation. You've got to pick it up, or get it in the mail, then you've got to get it filled in your local pharmacy. And so it's been much more those practical solutions that have been more difficult.
Okay, we've got a flurry of questions coming in before the cut-off. So Marnie asks, and then we'll come to Deborah and Darcy as well. Marnie asks, what do you predict the future of oncology to look like in the face of COVID-19? It's a big one.
It is a big one. So part of the challenge is that we're going to see a bit of a flurry of diagnoses as things begin to open up, and so that will put some pressure on the system. So really encouraging people to get out there if they've got symptoms and get diagnosed early. But it's definitely going to change the face of our consultation. So we're hoping that telehealth will be here to stay, particularly for follow-up appointments. Many of our Australian clinicians have been pretty reluctant to move to telehealth, and I think this has given them the push they need, and we'd like to see that backed up, and we're going to work with the Commonwealth Government around maintaining some of those items, we hope. But we're also seeing some changes to treatment that will be really important. It's been known for a long time, for example, that you can use less radiotherapy appointments for treatment of breast and prostate cancer, for example. So 3.5 weeks of treatment versus 6 weeks of treatment. But some people have been slow to do that, whereas through COVID-19, all of the radiotherapy services have moved to the 3.5 week treatment for most of the patients. So those kind of pushes to give more effective treatments with less contact with the hospital, I think will be part of the future. I certainly hope they will.
Yeah, a lot of positive changes there.
Yeah, absolutely.
So actually, I misspoke. Darcy and Deborah both were writing in to say thank you, which is lovely. And we've got another question from Laura. Laura asks, I've been wearing a fabric mask when I leave the house, but I'm unsure how often I should be washing it. Good question. I have no idea myself.
You should probably ideally wash them every time you use them to keep them really clean. So having quite a few that you can rotate would be the most effective way to keep yourself safe.
So John's just sent in a question. He says, I don't have cancer, but should I still go to my regular checkups?
Yes, you should absolutely go to your regular checkups and talk to your GP if it's a checkup with the GP or with your specialist about whether you can shift those to remote consultations or not.
Great. Well, I think we've gotten through all our questions. Well done, Sandra.
Thank you, Kate.
Oh, wait, one more is coming. Can you handle one more?
I can.
Great. So we have a question. All right. I have and had a stem cell transplant some 6 months ago. My hematologist says no vaccines for 12 months. How do I protect myself from the flu? And that's from Duncan.
Okay, so Duncan, if you follow all the spatial distancing recommendations for COVID-19, you're going to really reduce your risk of flu. But the critical thing is convincing all of the people in your family and friendship network to get the flu vaccine, and that'll be the way you keep yourself safe.
Yes, and that's very good advice for everyone, I think. If you can, please do get a flu vaccination. That's the advice from all the experts I've been speaking to over the last few months.
Absolutely.
Great. Well, thank you so much, Sandra. And thanks everyone for all your questions and tuning in. Sandra Aranda's been a great help at answering all of those niggling queries we've had in this time of many, many questions, and frankly, not that many answers about a lot. So if anyone has any further questions, if they need any further advice, where should they be going?
So just call 13 11 20 and one of our wonderful health professionals will be there to answer.
Great. And they can rewatch this on your Facebook page.
Absolutely.
Great. Well, thank you very much, everyone. I'm going to say goodbye. Thanks, Sandra.